What if I told you that science-backed strategies can help you fight those bulging leg veins without surgery, lasers, or pricey prescriptions? Stick around to discover the latest natural, minimally invasive solutions for varicose veins and practical everyday steps that actually work. Quick poll. Have you or someone you know ever struggled with visible leg veins or heaviness in the legs? Yes or no? Or share your experience in the comments below. Understanding varicose veins. What are varicose veins?
Varicose veins aren't just a cosmetic annoyance. They're a signal from your circulatory system about underlying venous function. These rope-like or bulging blue and purple veins, most common in the legs, develop when tiny one-way valves in the vein walls become weak or damaged. Instead of pumping blood back toward your heart, your veins allow blood to pool, stretching veins and increasing pressure. This process is called chronic venous insufficiency, and its symptoms go beyond visible veins. Aching, heaviness, throbbing, itching, swelling, even skin color changes or sores or ulcers can all occur.
Who gets varicose veins? And why? Varicose veins affect both men and women, but women, especially after pregnancy or age 50, are more likely to develop them due to hormonal influences. Genetic predisposition is powerful. If both parents experienced varicose veins, your risk may be as high as 90%. Other major modifiable triggers include obesity, inactivity, sedentary jobs, prolonged sitting or standing, and overall poor circulation. High-impact activities, chronic constipation, previous deep vein thrombosis, and hormonal fluctuations, menopause, pregnancy, birth control pills can all play a role. You might notice leg heaviness, fatigue, cramps, or even restlessness, sometimes worsening at night or after standing. Natural and minimally invasive treatments. What works and why? Herbal remedies for varicose veins. Gotu Kola Centella asiatica. Gotu Kola has centuries of use in traditional medicine for boosting circulation and strengthening vein walls. Modern studies confirm that standardized Gotu Kola extract improves collagen synthesis and elasticity, reduces capillary leakage, and lessens swelling and symptoms of venous insufficiency in varicose veins. Clinical trials consistently show greater improvement in heaviness, discomfort, and swelling with Gotu Kola treatment compared to placebo. Safety is generally good, with few side effects aside from rare mild digestive symptoms. Coarse chestnut, Aesculus hypercastanum. Coarse chestnut extract, rich in a compound called acin, has been shown in numerous randomized controlled trials to reduce leg pain, swelling, and itching in people with chronic venous insufficiency and varicose veins. Coarse chestnut acts by decreasing capillary permeability and improving vein tone. In direct comparison trials, it performs as well as compression stockings or rudicides in relieving pain and swelling. How it works? Horse chestnut reduces inflammation, strengthens vein walls, and lessens fluid leakage into leg tissues. Witch hazel, calendula, pine bark, bilberry, and ginkgo. Used in various topical and oral traditions for circulation and inflammation control. Venoactive flavonoid medications. What are venoactive medications? These are supplements or drugs derived from plant compounds, mainly flavonoids like diasmin, hesperidin, and rudicides that enhance venous tone, boost lymphatic drainage, reduce inflammation, and reinforce capillary walls. Micronized purified flavonoid fraction, MPFF. Example, Daflon. Proven effects. Multiple well-designed studies and international vascular guidelines now endorse micronized flavonoid fractions, MPFF, for treating chronic venous insufficiency and varicose vein symptoms. MPFF reduces heaviness, swelling, skin changes, and pain, while accelerating ulcer healing and improving quality of life. Mechanism. MPFF targets inflammatory pathways unique to veins, reducing capillary permeability and even decreasing markers of hyperinflammation after vein procedures. Guideline status. The European Society for Vascular Surgery and major international guidelines strongly recommend MPFF as an adjunct to compression therapy, especially in patients with advanced skin damage or ulcers. Compression therapy. The cornerstone compression stockings and bandages remain a mainstay in both prevention and non-surgical management of varicose veins and chronic venous insufficiency. Compression stockings significantly reduce swelling and discomfort, ease fatigue, and may slow progression of early varicose veins, especially in at-risk workers. In chronic venous insufficiency with ulcers, high compression, 30 to 40 millimeters of mercury, improves healing and reduces recurrence, sometimes outperforming bandaging. Compression is safe for regular use, so long as arterial flow to the leg is adequate, confirmed by ABPI testing, and stockings are properly fitted and replaced every 3 to 6 months. Guidelines for use: Class 1, 15 to 20 millimeters of mercury. Prevention. Class 2, 20 to 30 millimeters of mercury. Early to moderate varicose veins, mild edema. Class 3, 30 to 40 millimeters of mercury. Severe varicose veins, ulcers, or post-DVT. Best practice: don't stockings in the morning before swelling develops. Wear during day, remove at night. If you stand at work, below knee is usually sufficient. Thigh high for more extensive disease. Share your favorite tip for putting them on, or ask questions about finding the right fit in the comments. Leg elevation and exercise protocols. Leg elevation, raising your legs above heart level for 15 to 20 minutes, 3 to 4 times daily, reliably reduces venous pressure by up to 30%, decreases swelling, and promotes healing. At night, elevating the foot of your bed by 4 to 6 inches also helps. Recommended exercises: walking, 30 to 45 minutes daily, at your pace. Swimming or stationary biking, gentle on joints, very effective for circulation. Yoga and calf raises, especially poses like legs up the wall. Ankle pumps, leg lifts, rocking foot in seated position. Avoid prolonged sitting, high-impact running on hard surfaces, heavy weightlifting, or excessive squatting if you have symptoms. Dietary strategies for vein health. Why diet matters. What you eat can't cure varicose veins, but evidence shows a vein-friendly diet, rich in fiber, antioxidants, and specific nutrients, reduces constipation, inflammation, blood pressure, and the risk of developing or worsening venous disease. What to include? Bioflavonoids, antioxidant plant compounds. Best sources: blueberries, cherries, citrus fruits, dark chocolate, onions, spinach, buckwheat, green tea, apples, kale, broccoli, red grapes. Role in veins. Flavonoids strengthen vessel walls, support elasticity, prevent leakage and inflammation. High fiber foods. How they help. Fiber prevents constipation, which can otherwise increase abdominal and venous pressures. Best sources: whole grains, oats, brown rice, quinoa, legumes, beans, lentils, most fruits and vegetables. Vitamin C and E. Best sources: oranges, strawberries, kiwis, bell peppers, spinach, broccoli for C. Almonds, sunflower seeds, and leafy greens for E. Role. Vitamin C is essential for collagen synthesis, structural support of veins. Potassium and magnesium. Role. These minerals regulate blood pressure, reduce vein wall stress, and improve circulation. Sources: bananas, avocados, sweet potatoes, pumpkin seeds, leafy greens. What to avoid. Excess salt increases water retention, vein swelling, and pressure. Trans fats and highly processed foods worsen inflammation and vascular injury. High sugar items lead to inflammation and weight gain. Which of these foods do you already include in your diet? And which new ones are you curious to try? Comment below. Weight management and obesity control. The weight connection, obesity, and central body fat, apple-shaped bodies, markedly increase pressure on leg veins, making valve failure more likely. Research confirms that for each unit increase in body mass index, BMI, varicose vein risk rises by about 5%. Obese people are up to 3 times more likely to develop varicose veins. Benefits of weight loss. Losing even 5 to 10% of excess weight. Reduces pressure on veins and improves vein function. Lessens inflammation and supports better blood flow. Improves outcomes with existing treatments, including compression and medical procedures. How to achieve it? Combine dietary changes, regular low-impact exercise, and behavioral strategies, like tracking daily movement, reducing screen time, using anti-fatigue mats at work, and planning healthy meals. Workplace, postural, and footwear modifications. Practical preventive steps. Regularly move and stretch every 30 to 60 minutes at work. Use standing desks or switch sitting to standing. Wear supportive, flat or low-heeled shoes. Not high heels. Consider anti-fatigue mats if standing for long periods. Ergonomic footrests and chairs to promote circulation. Avoid tight clothing around the waist and legs. Elevate your legs and take micro breaks. Leg elevation breaks, 15 to 20 minutes, several times a day, especially after long standing. Mini exercises, calf raises, ankle rolls, tiptoes, and walking in place for 5-minute intervals. Topical and natural approaches. Essential oils and creams. Horse chestnut cream, witch hazel, butcher's broom, calendula, and Gotu Kola creams are used in Europe and the US for symptomatic relief of heaviness, discomfort, and swelling. Essential oils, cypress, chamomile, helichrysum, lavender, lemongrass, geranium, peppermint, as topical preparations have anecdotal, though not definitive, evidence for improving circulation, reducing inflammation, and soothing skin discomfort, provided they are used safely and diluted with carrier oils. Massage and compression, light, upward massage, always toward the heart, may support blood flow and comfort. Always check with your healthcare provider before starting topical treatments, especially if you have sensitive skin. Prevention strategies, evidence-based everyday habits, daily interventions. Move every 30 to 60 minutes. Even a minute of walking or stretching at your desk matters. Elevate your legs whenever possible. Maintain a healthy weight. Eat a high-fiber, low-salt diet. Wear compression stockings if you have a family or personal history where work involves long-standing sitting. Avoid tight clothing, high heels, and crossing your legs for extended periods. Use anti-fatigue mats if standing at work. Hydrate well. Dehydration increases blood viscosity. Quick recap, key takeaways. Varicose veins are more than skin deep. Natural and minimally invasive treatments work from herbal remedies like Gotu Kola and horse chestnut to medical-grade compression to life-changing movement and nutrition. Prevention is daily and doable. Move more, eat smart, and elevate those legs. Conclusion. Inspiring action, you don't have to surrender to bulky blue lines or live with the ache and heaviness of varicose veins. Science gives us a powerful toolbox of lifestyle tweaks, natural remedies that fit into real life. So, why not take the first step, literally? Move, nourish, and show your veins some love, because life's too short to live in discomfort. If you found something helpful today or have a question, drop a comment, share this video, or hit subscribe for more actionable health tips. Your journey to healthy, beautiful legs starts now.
Take good care of yourselves, and don't forget to like, comment, and subscribe.